All right, let's jump right in. If you're studying renal and urinary disorders, you know it can feel like a mountain of information. So today, we're going to cut through all that noise. This is a high-yield review focusing only on the absolute must-know concepts and clinical tips.
First things first, a massive thank you to Dr. Abdulkareem for putting together this fantastic material. Now, what's on the slide is super important, so listen up. Think of this as your study buddy, a tool to help you review. It is absolutely not a replacement for going to class and talking with your instructors. Okay, with that said, let's get to it.
So we're going to follow what I like to call the clinician's path. It just makes sense, right? First, we'll nail down the essential diagnostic tests. Then, we'll see how those tests apply to real-world problems like UTIs, kidney inflammation, renal failure, and of course, kidney stones. It's a logical journey from the basics to the complex stuff.
Okay, Section 1. Assessment and diagnostic keys. Honestly, everything, and I mean everything, in renal medicine starts right here. If you don't get these core tests, you'll be lost. So let's make sure we've got them down cold. First up to bat is serum creatinine. The easiest way to think about it is this. Your kidneys are a high-tech filter. Creatinine is just normal muscle waste that the filter is supposed to get rid of. So if that filter starts to get clogged, what happens? The creatinine backs up in the blood, and that number goes up. That normal range, 0.6 to 1.2, you got to burn that into your memory. It's the big one.
Next, we've got BUN, or blood urea nitrogen. It's another waste product that kidneys are responsible for clearing out. Now, here's a little exam tip for you. BUN can be a bit tricky because other things, like being dehydrated, can make it go up. But when you see a high BUN and a high creatinine together, that is a huge red flag pointing straight at the kidneys. And that normal range, 7 to 18. So why are we so obsessed with creatinine and BUN? Well, because they help us estimate the glomerular filtration rate, or GFR, and the GFR is the real MVP. It's telling you the actual amount of blood your kidneys are cleaning every single minute. A healthy person is filtering around 125 milliliters a minute. When that number starts to drop, you know for sure the kidneys are in trouble.
So, let's put it all together. This slide right here, this is your flashcard. Seriously, for any test you take, you need to know these three values like the back of your hand: creatinine, BUN, and GFR. Know the numbers and know what they mean. This is absolutely non-negotiable.
Let's move into our second section, urinary tract infections, or UTIs. When you're thinking about UTIs, I want you to repeat this mantra: location, 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 because knowing where the infection is tells you pretty much everything about how serious it is and how the patient will feel.
So here's that critical dividing line. Down in the lower tract, you've got cystitis, which is just a fancy word for a bladder infection. Yeah, it's annoying and uncomfortable, but it's usually not a huge deal. The real problem starts when those pesky bacteria decide to travel upstream to the kidneys. That's called pyelonephritis, and as you can see, it's way more serious. We're talking risk of permanent kidney damage. You see this slide? This is basically an exam question waiting to be written. Look at the left. Lower UTI symptoms are all local. It burns when you pee, you feel like you have to go all the time, maybe some pain right above your pubic bone. But look to the right. Upper UTI symptoms are systemic. The whole body gets involved. We're talking fever, chills, and the classic sign, flank pain and CVA tenderness. That's when it hurts if someone gently taps on your back right over the kidneys. That's how you tell the difference.
Okay, let's keep building on this. Our third section is all about kidney inflammation. We're going to compare pyelonephritis, which we just touched on, with glomerulonephritis. I know, the names sound super similar, but trust me, they are two totally different beasts.
And here it is, your ultimate cheat sheet for telling them apart. The main difference is this. Pyelonephritis is a direct bacterial infection that has invaded the kidney. That's why the body sends in the troops, white blood cells, which you see in the urine as pyuria. Glomerulonephritis, on the other hand, is an inflammatory reaction. It's often triggered by a recent infection somewhere else, like strep throat. That inflammation messes up the kidney's filters, causing swelling, high blood pressure, and letting red blood cells leak out, which gives you hematuria.
And if you remember one single thing about glomerulonephritis, let it be this phrase: cola-colored urine. It's the classic description for a reason. All those red blood cells leaking through the damaged filters stay in the urine this dark brownish color. It's a sign you won't forget.
So this sets up the perfect test question, doesn't it? A key risk factor for acute glomerulonephritis is a recent history of, you got it, a streptococcal infection. So if a patient tells you they had a really bad sore throat about 10 days ago, your alarm bells for glomerulonephritis should be ringing.
All right, let's tackle a huge topic, our fourth section, acute versus chronic renal failure. And the single most important word to remember when you're trying to tell these two apart is time. It's all about how fast the damage happens.
But before we can compare them, we've got to know this term, azotemia. Remember those waste products we talked about in the very first section, urea and creatinine? Well, azotemia is just the fancy medical term for when those waste products build up in the blood. It's the lab result that proves the kidneys aren't doing their job.
And here's the core of it all. Look on the left. Acute kidney injury, or AKI, is like a sudden lightning strike. The kidney function just crashes over hours or days. But here's the good news. There's potential for recovery. Now look at the right. Chronic kidney disease, or CKD, is a slow, quiet, progressive march towards failure. It's irreversible, and sadly, it eventually leads to end-stage renal disease.
So for an acute injury, our management is all about crisis control. We're trying to support the body and give the kidneys a fighting chance to heal. That means we're watching fluids like a hawk, we're treating life-threatening problems like hypotassium, that's hyperkalemia, and we're correcting acidosis. Essentially, we're stepping in to do the kidney's job for a little while.
All right, we're on to our final section, the challenge of kidney stones, or urolithiasis. These things are super common, and as anyone who's had one will tell you, incredibly painful. So let's quickly walk through the game plan.
The approach to kidney stones follows this really clear four-step path. Step 1, and this is the most urgent one, relieve the pain. It can be just awful. Step 2 is to actually get rid of the stone. Step 3, we try to figure out why the stone formed in the first place. And step 4, which is arguably the most important, is preventing it from ever happening again. And that's where we, as healthcare providers, can make a huge difference with patient education, especially about drinking more water.
So as we wrap this all up, what's the big takeaway? The crucial point is that whether we're talking about a simple UTI or full-blown renal failure, telling these disorders apart usually comes down to just a handful of key signs and lab values. Things like creatinine, GFR, CVA tenderness, that cola-colored urine. These are the clues that tell you what's going on.
And that brings us to our final thought. Let's put everything we've talked about into practice with one last classic scenario. You have a patient who had strep throat a couple of weeks ago. Now they come in with high blood pressure, they're swollen, and they tell you their urine looks like cola. So which condition is the most likely diagnosis? I'll let you piece that puzzle together. Thanks for joining me.